my presentation, once it's uploaded, intends to look at the ways in which we can integrate medical humanities in medical education altogether. So that would be bottom line, the aim at the end. But meanwhile, I will go through a number of points of trying to define in one way or another the meaning of medical humanities and on humanities in general. And I'm very pleased with how this conference went through. And I think there are going to be, by definition, being the last talk, some of the points that I am going to make will be a rehearsal of the various concepts which have been discussed and presented earlier by one or another of the speakers. So let me start, and and probably I will also turn the camera off because I don't want to have drops on the messaging, on the communication. So let me start with a rhetorical question, I would say, that is partly philosophical, and there was a lot of philosophy today, partly romantic, let's say. And the question would be, in real life, what do we think people consider as the most important elements for their lives? And well, certainly, obviously, there are many things they could consider as being relevant, but particularly true and particular for people of a certain age, a middle age upwards. One of the most important issues is the maintenance of a balanced health status. But certainly most of the times this health status is taken for granted because usually people are in good health. Thank you very much. And they are busy with their life, going on with pleasure, sometimes problems, some other times work and entertainment, but the health status is maintained. And let me see if I can point right. Health status is maintained. But we know, and particularly at these COVID times, we know that, and that was a forceful reminder of the fact that health status from time to time could become problematic, could become a faltering, could become shaky, could start to go down. And the question is, what is happening in such instances? What do people do? Well, usually they find recourse to medicine, and medicine becomes a mean of dealing with the disease state. And it's interesting to look a little bit at the meaning or the etymology of this word disease, which we take it as representative of illness, and we'll see in a moment why, because in Latin dis is a compound which has a negative connotation reflecting a lack of or opposite to, whereas the English word, the English meaning for the word is physical comforts, undisturbed states of body, peace of mind. So disease is basically lacking that physical comfort or peace of mind. So medicine in that case can be seen as a profession which mediates in a way between the individual, the person, and his or her own medical status, health status. And thus medicine is called upon exploring the reasons for this unbalanced state, maybe provide a diagnostic, a cause if you want, and also provide the basis of treatment for this disabled or unbalanced healthy state. And nowadays, medicine is extremely affecting and very precise in most instances, particularly when we're dealing with the acute diseases. Probably less so in chronic diseases, but for the acute cases is very precise. And a good part for this is because medicine has become, probably for more than 150 years from the middle of 19th century, a stronger science. But let us reflect for a moment, and it's clearly that from the beginning of the science all the way to today, medicine does not intervene on its own in this balance. We have never been in a territory of automated medicine. I said we have never been. although now the developments of artificial intelligence bring more and more nearer that particular possibility. And there are even now ways in which triaging, for example, by phone medicine is done by automating algorithmic systems, or even more relevant, image recognition, for example. AI image recognition systems are sometimes better in recognizing images and putting diagnostic, radiological diagnostic better than young physicians, young radiologists. But returning to the point, medicine is applied usually by a person, by an individual, and that individual is the physician. The physician is the person interposed between a suffering patient and the diagnostic and the treatment intervention that are going to be delivered. And usually this patient facing the physician is in a state of distress, is anxious about what it is to come, is anxious about the diagnostic, anxious about the potential problems and the risk associated with the treatments. And also, he or she is in most instances is not a scientist, is not a medic or a medical scientist, and thus will not have a proper understanding of the probabilities, risk associated with the various treatments, the subtleties of differential diagnosis, the ifs and buts, and the subtle nuances and differences between various approaches. And furthermore, the patient, particularly nowadays in which the information is so easily available and there is always a Dr. Google available for consultation and information and so-called advice. The patient will come to this meeting, will come to the meeting with the physician with an individual perspective, their own perspective, representing the individual history and their own experience. And sometimes that experience is influenced also by the familial environment, by the social medium, and so on and so forth. And all these elements are creating a filter system through which the patient, he or she, will receive the information. Thus, in this perspective, the physician is not only a science specialist which is dealing with a diagnostic and treatment intervention, but it's also a mediator and translator of this science into human terms. And in order to be more effective in this mediating position, the physician needs to be obviously aware and conversant with a whole range of human values. And when I'm talking human values, I'm not talking about the moral values, the good or bad, the ethical issues which were addressed in previous presentations, but also the cultural and intellectual values which a patient might present. And also, a physician might be also aware, particularly in these times of medical burnout, which is frequently discussed, that engagement and understanding of such human values would be relevant not only in dealing with the patient, but also dealing with themselves. So I'm insisting here in this slide on the importance and being awareness of the human values in doing medicine. But I think all of us are aware of the fact that many people, clinician and surgeon including, and probably many of them, who will not agree with this point of view. They will say that there is little time in a very, very busy medical curriculum for spending time on such soft issues like human values. They will see that medicine is a science and thus is based on facts and on objective facts, and then the medical decisions will be taken on that particular ground. And those facts and those strong and clear-cut arguments will leave very little time and space for personal preferences, for subjective interpretation. Let us look for a moment and what is the gold standard for practicing medicine in the 21st century, is what is called the evidence-based medicine. And I'm giving here a definition of it coming from one of the founding fathers of evidence-based medicine, David Sackett. This is from a paper in 1996, in which the definition provided is that EBM, the evidence-based medicine, means effectively integrating individual clinical expertise with the best available external clinical evidence obtained from systematic research. Now, let us look for a moment at this definition because it comprises two terms. We don't have any problem whatsoever in understanding this best available external clinical evidence. These are the facts. These are the data coming from textbooks, from journals and articles, from the latest reports coming from the various medical bodies and so on and so forth. Those are the facts. But what we see here, that there is the other crucial element, is the individual, the actual physician who will need to apply all this evidence and integrate all this evidence with their own personal expertise. As I said before, is not an automatic system which applies data, facts as they are, but that needs to be integrated with personal experience coming from a clinical practice. And I ask you then, can an individual experience, if we are talking about an individual, can this individual experience ever be totally objective and unbiased? This is a way of returning to the fact that medicine is a science, but also should include values and should take into account the values. Now, another proponent of the EBM, John Carriage, really gives an answer to this question, rhetorical question, which I ask here, that personal experience has to be always influenced by personal biases and values, the word values again, also by economical and political considerations, and also by philosophical principles. They give an example here, the concern for justice. Obviously, those kind of concerns will always affect the decision, not only in terms of diagnostic, but in the efficiency of the treatment. Okay, so what we are talking here is about the importance of human values, about understanding the human's perspective. And all these usually are studied by humanities. So in that case, it's obvious another rhetorical question. Well, what are the humanities? And all of us discuss about the humanities in this presentation, but nobody has attempted to give a definition. And probably one of the reasons for that is that, and I'm using a tongue-in-cheek definition, when St. Augustine, this is a philosopher from the 4th century of the BCE, when he was asked to define time, he said, well, if you don't ask me, then we know what we're talking about. But if you ask me to give a definition, well, we are left empty-handed because it's so difficult to give a definition. Well, he was talking about time, but I would say that we can use the same way of approaching in terms of the humanities. Okay, joke apart, if we are really trying to define the humanities, well, we can categorize them. First of all, in the area of humanities, there will be academic disciplines that are concentrating on defining and looking at the human culture and or the expression of human mind. And this includes a variety of topics like the study of languages, either the classics or the modern, philosophy, and we discussed ethics just in the previous presentation, literature, again mentioned several times, visual and performing arts, and so on and so forth. But we'd also, and this is fashionable in the last probably the good number of years, probably 30, 40 years, that in the definition of humanities, one can include disciplines which are taking a social dimension, look at the social perspective, and also includes the cultural understanding of the world. And here it's a list of these possible, apart from social sciences, history, anthropology, and so on and so forth. So if one is to, if you want, venture a definition of humanities, short and sharp, one could say that the humanities, obviously including the social sciences, teach us about how people have created their world and how they in turn are created by them. Now, also, I would, before going any further, I would want to give a little bit, and it will be useful to think of some of the characteristics which we can associate with humanities. This is not an exclusive list, obviously, but they are crucial from the perspective of what we are discussing. They are very important characteristics. First of all, in terms of the methodology, what characterizes humanities is that they are taking a critical look, an analytical look at the topics they are investigating. And those looks are taking a very powerful reflective, they have a very powerful reflective component. And also they have a significant historical element. That's an element which is very important in providing context and the feeling of becoming of the topics which are examined. What I'm thinking about this context, that something, when you look at it from the perspective of humanities, something which is observed now, the topic under discussion, the humanities will not look only at the current moment, but they will understand whatever they are studying from a historical perspective, that they started from somewhere and they developed through time in one way or another, and understanding what is now depends very much on understanding how the things became to be what they are now. And that is very different, and this to be distinguished from the approaches used in natural sciences, which are mainly on the main empirical approaches, and they are just taking into account what is observed now at the present time. Do the measurement, obtain the data, put the data together, draw a conclusion on the basis of what it is. Obviously, that's a little bit of an exaggeration, but here I'm making the points. Another very important, that had been addressed one or two times in the meeting before, humanities are focusing on an understanding of meaning, the purpose or the goals of action and activities. And with this, humanities allow for a better appreciation of the singular historical and social phenomena, rather than, as the sciences are mostly doing, taking an average, putting all the things together and providing an average and discussing the average. Obviously, this approach is very different from the scientific method and the natural sciences approach, which is mainly concerned not with meaning, but with looking and discovering causality of events, and from there drawing conclusion about the universal truth and the laws of the natural world. So I would say that overall, these are important characteristics. And before going further, I would make a particular point about and subtle points about how to understand humanities, that there are at least two ways in which we can understand humanities. One of them is to understand them as an academic discipline, and most of the time, and what I've been discussing up to now, is mostly focusing on academic discipline. But those will have a focused area of investigation and will provide a knowledge, an in-depth knowledge, but of a relatively restricted field. So, for example, in history, you would have a specialist in, I don't know, the causes of the French Revolution or the tank battles of the Second World War. And they will be less prepared to discuss about the importance of changing from the Roman Republic to the Imperial Republic and so on and so forth. But there is another understanding of humanities, the humanities as a state of mind, the humanities as a cultural environment that will create or allow for the openness of one's mind to the what I called others' experiences, creating this space in which one can start looking at what other people are feeling. And this is if you're on the basis of these components of empathy and compassion, which is discussed very significantly in the context of medical humanities. So from this perspective, humanities are events, cultural events, and they are engaging and providing the means for creative expression of the human mind. Okay, once I've offered this overview of humanities and rushing through it, let us return to the topic of how relevant are these humanities in the medical context. But before doing that, I will address a question which has only mentioned briefly here and there in this particular presentation, but I think it's crucially important to understand it. Remember the slide in which I was presenting medicine as being the mediator between an individual and their health status. And well, for the medics, that is indeed what it is all about. The medic sits here and provides or improves the health status of an individual, as discussed before. But if we reflect for a moment about what health status means, how it is recovered following disease, what it means to maintain and promote healthy status, we immediately realize that there are many other instruments or factors or individuals or profession then contribute in a direct way, an essential way, to this process of maintaining or recovering health status. Let's ask, for example, we immediately see that apart from the nursing in a hospital environment, the nursing will be an immediate and essential contributors to recovery of health status. Depending on the type of disease or affliction, there will be other professions involved, physical therapist or counselor. But that is not all. And particularly in the COVID time, we realize the importance of the social care element. Sometimes maintenance of health status or recovery involve a significant social contribution and participation, like for example the care homes for the aged people, and particularly in the UK have been a lot of discussion and problems because these social care structures were not well adapted to cope with the challenges provided by the COVID pandemic. Also, if we're thinking of the recovery of health or maintenance of health, there will be another set of factors which one will need to take into account, like, for example, economic factors or environmental factors, which are directly contributing to the health status. So health status is a very complex term with many factors contributing, not only the physician. And then if we make the point that for an individual and to understand the individuals and his or her engagement with their health status, that we need to take into account the person's value, the human values. Well, we understand immediately then that talking only about medical humanities, it's quite restrictive. And that is the reason why probably in the last 10 years, in the last decade, the idea of the medical humanities is slowly transforming into a much wider concept and becomes only a part of the much wider context of health humanities. So, but because in this presentation I'm mostly interested in the education of medical students, I will continue to talk about medical humanities, but you need to understand that in a wider context of the health humanities. And then, so if we are concentrating on medical students' education, then a question is, what is effectively the role of medical humanities in the medical education? And that is a crucial role. And I'm going to discuss it by providing evidence coming from two very, very powerful medical nations and schools, the American and the UK one. In the American, the regulator of medical profession is the American Association of Medical Colleges. And they see the relevance and the importance of the medical humanities to such an extent that they produce a specific report called the Fundamental Role of the Arts and Humanities in Medical Education. And their conclusion, bottom line, this is from the executive summary, is that by integrating arts and humanities throughout the medical education, trainees and physicians can learn to be better observers and better interpreters, and they can build empathy, communication, and teamwork skills, and more than that. So that's a crucial role, and that's the reason why many American medical schools, humanities play a significant role. And even more interested, and I'm putting here relevant information for those of us who are interested in developing such programs in Europe, the American Association of Medical Colleges is willing to provide resources to help medical educators develop and implement such such programs in their medical schools. Now, in the UK, which is a situation which I know a little bit better, the situation is a little bit less clear, it's less stated upfront like is in States. The regulator in the UK is the General Medical Council. And in 2018, they provided an update for the outcomes for the graduates, i.e. what is a medical student ending their medical training, what it is expected to do. And those are listed in basically 3 sets of outcomes. One of the outcomes, like for example, this one, it's on professional skills. Yeah, that's only medical information. You need to be up and ready with the medical information. There is a third set of outcomes, which is professional knowledge. And here some of the disciplines or some of the requests can border with disciplines which are covered by humanities, like for example, looking at social sciences, also psychological principle, applying psychological principle, clearly so applying biomedical scientific principles. That will be the part of philosophy, the philosophy of science, and so on and so forth. But let us look at the first set, which is called upfront professional values and behaviors. And if we look at the list of these 6 categories of outcomes, we see that effectively most of them, if not all of them, are parts of the territory to which medical humanities will be delivering or could and should deliver, like professional and ethical responsibility. Well, Berta just discussed about that. Legal responsibility, leadership working and team working, and so on and so forth. So that is clearly that medical humanities is central to, or should be central to, the medical education. Now, let me approach also from a slightly different perspective. And some colleagues of mine are asking me, but why, in fact, why, what would be the reason for providing a medical education for a medical humanities in the medical education? And let me briefly touch upon these reasons, because I think they are quite relevant, and I categorize them or put them in 3 categories: professional, educational, and personal. Now, from the professional perspective, one of them is that by exposing students to medical humanities during their education, they will get a better appreciation of the patient as an individual. And here it's a whole discussion touched upon, I think, once or twice in this presentation, and the difference between the medical model, simply concentrating on the disease, to the much more holistic model of the biopsychosocial model of care, in which the individual is seen in a more holistic way. That is one point. Another one is that by exposing to medical humanities, the students will have help in maintaining and reinforcing the values of empathy and compassion, relevant, as I said before, not only for dealing with the patient, but maybe dealing with themselves. From an educational perspective, everybody talks again and again about the role of medical humanities in developing what is called the softer skills, which are relevant and crossing across many of the medical disciplines. And within these skills, we are talking about the critical and analytical skills, or the development of cultural sensitivities and openness to a set of values of the others. Now, the point is that many people are calling these softer skills, but it is my experience, and probably some of my colleagues will share that experience, that development of critical and analytical skills in the doctors, in the young students studying medicine, it's a very, very tough job to do, and takes a lot of application and takes a lot of effort, both from the educators, our task, but also from the students to engage with them. So the softer skill, I wouldn't call them softer skill, I would call them very, very important and tough to develop skills. And I think here the important point is that from this educational perspective, that by doing and working with medical humanities on a regular basis, what we are helping to develop is not a set of technical skills, box ticking, but rather what we want to do is to develop a habit of mind for the student. So whenever they are facing a new situation or a new patient, they will automatically go and participate or taking or using the tool set developed by the medical humanities. And now looking at the last set, the personal set, well, the personal reasons for exposing to medical humanities is that these medical humanities, through their capacity to engage reflection, as I said before, through exposure to cultural and artistic events in doing the various modules and so on and so forth, and understanding the different perspectives on the surrounding realities, all these provide for a better personal balance. I'm talking here about the student or the young physician, and this helps preventing the burnout and also promotes the well-being of the individual health professional. This would be either in the early stages like a student or throughout the development of their career, coming again and again as part of their continued professional development. Okay, so this would be the rationale and the reasons for developing medical humanities. But what are, in terms of from a perspective of a medical curriculum, what would be such topics? And here, together with my colleagues from Pécs, which in fact the two of them presenting here, Professor Chato and Bea, we looked at the various topics which are already presented as optional courses at the university, in the medical school at the University of Pécs. Some of these courses are already offered. Some of them could be offered because we have the people who would be in a position to develop some modules. Most of them would be, in this initial instance, will be disciplinary, but some of them will take an integrated or interdisciplinary take by looking at the variety of things and how could we bring these various different medical humanities, integrate them and provide answer to very difficult and significant questions, like, for example, we discussed today vaccination and anti-vaccination, or evolution, biological evolution and health, and so on and so forth. All these are very, very relevant things. And as I said, these would be the kind of topics which should be available for the students. Now, okay, we have a list of potential topics. The question then becomes, how should they be delivered? Because, and here it's a very, very important point, one of the most crucial and important point is that for medical humanities as being provided on a horizontal integration, so that the students are always aware throughout their medical education of the existence of medical humanity topics, and are able and will be able to take courses at various points, and that all in all, encouraging and development of that state of mind, habit of mind that I described earlier. So here would be, to end the presentation, would be an approach which I propose as being effective in terms of implementing and achieving this particular goal. So here it's a representation. The medical school in Hungary, it takes place upon 6 years, in which the first 3 years, let's call them preclinical phase, the students are mostly becoming aware and accustomed with the scientific basis of medicine, and year 3 and 4 will be the transition towards clinic, and then year 4, 5 and 6 would be effectively clinical years in which they will learn the ABC of various medical disciplines. Now imagine for a moment that above all these structures of 6 years, there is a holding structure, what I call the medical humanities educational arch, a holding structure along which we can place the variety of courses, the variety of topics of humanities that I proposed. Some of them would be related mainly with the scientific part, the preclinical phase. Some of them would be more relevant probably to the clinical phase. Some of them would be more generic, and some of them I'm also putting here will be the interdisciplinary modules. One can take and devise them in one way or another. So that would be the perspective. And then how would one actually implement such a possibility? Well, one option, and here it's just a proposal, then one option is that basically some of the topics will be obligatory. Bioethics or medical ethics, medical communication, critical thinking, and medical diagnostic, particularly medical diagnostic and the basis for differential diagnosis and so on as a technique. All these would be obligatory and let's say given in the year 1, 3, and 5. And here, the next step is where the arrangement becomes interesting and probably unique as a proposal, is that a medical school could require that all students, in addition to these 3 obligatory topics, should choose, as they like, on their own area of interest, another 2 topics as optionals, one to be delivered in phase 1, and another of these optional to be taken in the 2nd year. So, for example, a student could choose to take history of medicine in year 1, or history of medicine could be taken in year 4, just as an example. Or arts in medicine could be taken by again by a student in year 1, but could be taken also in year 6, and so on and so forth. And the point is that here the choice is entirely at the discretion of and the interest of the student. And also the crucial point is that all these topics, particularly for the optionals, will be available throughout all the 6 years. So the students will always be available and will have reference to the fact that there is a medical humanities approach, a medical humanities way of thinking. Now, the point is that maybe this slide, it's a little bit complicated, so let me give an example of 1 or 2 actual ways of implementing. So, for example, student 1, we decided that those would be the obligatory bioethics and medical communication and critical thinking in these years. But this student 1 will choose to do history of medicine in year 1, they choose, and then they will choose to do an interdisciplinary in year 4. Very good, that's what they chose. Another student will take the 3 obligatory courses, but they will choose to do medical anthropology, for example, in year 2, and they will choose to do narrative medicine in year 4. And then yet another student will choose to do, in addition to the obligatory one, will choose to do methods in scientific, methods in science and in medicine in year 2. They will take an interdisciplinary module, and because they have an entrepreneurial mind and they are interested in taking and developing some ideas, they will take in year 6 medical entrepreneurship, because students should be allowed and they'll have the opportunity to take these optionals. So all these are just models of what it is proposed, and there will be examples of a potential approach. So I will stop here, and I hope that I managed to convince you, the audience, about the importance of and relevance of the medical humanities in medical education. And I also illustrate one potential approach of delivering medical education, medical humanities, through this medical humanities educational arch as a possible way to actually implement medical education in a very, very busy medical curriculum. I think if we try, we can make it happen, and I thank you for your attention.